Hello, good morning to you. Welcome to business. We want to take you straight to Kumasi now, where there's a launch of the rapid test kit for coronavirus.
To the infection by producing antibodies. So, if you're able to detect those antibodies, it tells you that there has been some infection in you. You don't necessarily have to find the agent itself. But that antibody, represents the fact that you've come into contact with that agent, And there are two different antibodies that are in play here. There's one antibody that is developed very early in the infection, current recent infection. We call that immunoglobulin M or IgM. And there's one that's the IgG. IgG tells you that if you've recovered from an infection, IgG will tell you that this person who has recovered has had the infection before or has been exposed to the agents, the virus before. And both are very important when you need to determine the numbers of people who've been infected with this virus. It is not necessarily those who have been infected, but also those who have been infected and we know they are currently infected, but also those who have also been infected and not known they've had the infection, or who have also been infected and recovered from the virus. The current molecular-based or PCR technology will not tell you those who've been infected and are well. Those who've been infected do not know they have the virus, or those who were infected symptomatic with symptoms, but they've all recovered and they do not know they had it, or they knew they had it. But PCR will not tell you, but an antibody-based test from its IgG will tell you that such a person has been infected and recovered from the infection. Like I said, all these numbers are important for us to know so that we have a good idea of the number of people who've been infected, which will help all the infection control efforts that the country is making. So this rapid diagnostic test, or this antibody-based test, comes to augment or complement what PCR testing has been doing already. It is not coming to replace PCR testing, but it comes to augment what it has been doing, and it has its place in the whole diagnosis of coronavirus infection. In fact, the WHO has said that for surveillance purposes, when you are looking for people, you are testing mass people in the community, this contact tracing we are doing, this rapid diagnostic test has a place in that. But I want to say that in the whole gamut of coronavirus diagnostics, it comes to complement or augment what the PCR testing has been doing. And importantly, as we keep on hearing from the Minister of Information and the President himself, we need to ramp up testing. We need to try and test as many people as possible. Because if you don't test, you know those who've been infected. As you all know, some people are infected without even knowing they've been infected. So they may not even go on to seek care. But if you test them, and they are infected, then you know what to do for them, whether they have symptoms or not. So ramping up testing, like we're doing for this contact trace, all these in the past, you know that when the lockdown came, one of the issues was that so that we could test as many people as possible. And a lot of samples came through to Noguchi and KCCR as well, And the testing was delayed, We've said that when you test somebody, you need to be able to get results and act on the results immediately in real time. But if results are going to come back late, it may delay, the results will be delayed, and which will mean that you may not want to put in place any measures you wanted to. So this is one place that this particular rapid test, which like you read from the piece, takes 15 to 20 minutes to do. We'll be able to tell the health authorities and everybody in real time what the test result is, so they can also act on it immediately. That's important. Again, this development and manufacturing, like I said, fulfills two objectives that the President talked about in the country's fight to contain the spread of the virus and inspire the expansion of our domestic capability and deepen self-reliance. So we have our own scientists in this university with KNUST Diagnostics, having done the research and development for this, okay, and KNUST itself, okay, having manufactured, is in a position to manufacture and produce this test at scale. Okay, so this deepens local capacity or local capability. Okay, and our self-reliance in the fact that we can do things as Ghanaians ourselves. There are a lot of opportunities that have come the way of industry and others during this epidemic. It has shown the resourcefulness in us as a country. Okay, and the development and manufacture of this test kit, okay, shows likewise. As I said, the partners in this development have been researchers from the Department of Medical Diagnostics of this university, the Department of Clinical Microbiology. And here I want to say that I'm sitting here with the hat of a professor in clinical microbiology. I'm not sitting here with the hat of a provost of the college, as I was introduced by okay. I'll be leading the research team as a professor in clinical microbiology to go through this test. So it is in this capacity that I've been involved in this kit development. Then also there's been KNUST I've talked about today. And also there's a local company in Ghana, in Kumasi, Dex Technology. I'm sure some of you know them, Dex Technologies. In the wake of the whole coronavirus global outbreak and trying to source materials to produce this kit, it hasn't been easy. It hasn't been easy getting materials because most materials, I want the one there. Most materials, the one who's spoken already. Because most materials have had to be sourced externally. This includes this cassette. Okay, KNUST used to procure from abroad into this country. Okay. But every country is struggling and many industries are working on developing similar test kits. So these cassettes have been in short supply globally. So KNUST reached out to Dex Technologies, which is, I said, is a local hardware manufacturing group in Kumasi, okay, who sat with him, went through developing the cassettes and printing it by 3D technology. Okay. One of the reasons why this whole thing has delayed is getting this. Okay. So it was a local company, Dex Technologies in Kumasi, that has designed and 3D printed this for use in this country. So this is part of the local capacity that has come into making this kit. Now, you've seen the test materials there. Okay. This may not be the final product. As said, this thing needs to go through regulatory approval. In Ghana here, it is the FDA, okay, that regulates these issues. The FDA does not only look at approving food or whatever, it's also very important in medical devices. Okay. So the FDA is going to do some work on this to make sure that it works, it is fit for purpose, okay, before it can be used in Ghana here, okay. Importantly for us, the FDA works with developers as well. So if there are any issues with what you've brought, okay, the FDA will work with you through those so that the process is refined and you get a good product for the country. So it's important we are respecting FDA guidelines, and until they've gone through what their regulatory duties are, we cannot go ahead and market this as such. I want to say again too that one of the things that also have delayed, we started this many months in March thereabouts, okay, and we've used, there are 3 different rapid test kits that we've developed. Okay, 2 of them, FDA is having a look at them now. Next week, they'll have the 3rd one. Okay, they are all from different antigens. Okay, so there are 3 of these we are going to send to FDA for them to work on it. So we know how each of them performs. Okay, so that we'll further do some optimization if necessary, and then come out with the one that not only FDA is happy, but also the Ministry of Health, Ghana Health Service is happy. Throughout all this work, the investor in INCAS has been in touch with the Ministry of Health, okay, and importantly, the National COVID-19 Response Team. Dr. Nsiah has been very instrumental. He's encouraged us daily along the line. Okay, he calls every day to find out what is happening to our test kit, because he knows we are doing this. And we've benefited a lot from the encouragement he has given us. Sometimes I think that he himself has had so much pressure from outsiders, so he puts the pressure on us. But whatever it is, he's giving us a lot of support in the development stages. So what is the next step? As I've said, this is going to go through the FDA. As Gadi Asawatri said in his post yesterday, fingers crossed. Okay, well, we are optimistic that this thing will be fit for purpose for us to use in this country. As said in the press release, there are many advantages of this kit, okay, in terms of our own efforts at containing COVID-19. We are also, in the future, it's one of the things we try to do is to try and develop these kits that we can use very close to the patient, okay, that can get us results in good time, okay. So the collaborators, INCAS and ourselves, are still also working on a PCR type-based test, okay, which can give us results in 45 minutes. Currently, your PCR test gives us how many? Yeah, about 6 hours. 3 to 6 hours. Yeah. About 2 to 6 hours. That's why the current PCR gives results, before those results are being transmitted. We are working on a rapid PCR diagnostic that can give us results in about 45-50 minutes. It is still work in progress. Working with the Ghana Health Service, they've also told us that you could quickly do this antibody test for us, and then have a look at the PCR later, because there's already PCR test being used in the country. But we are looking at coming up with one that you can do in a shorter time than the current one. So we are grateful to all Ghanaians for the support and encouragement throughout the process. Importantly, as said, our Vice Chancellor has also been very encouraging in this. We also had to work with some external partners. Mologic company is a UK-based company that has been helping us in this development. You must have heard in the news about 2 or 3 days ago some story about Senegal, okay, in the development of this same type of test. Now, I told you there are 3 different antigens we've used, 3 different tests we've used. One of these, okay, the source material for doing this is from this UK company, Mologic. Okay, the other 2 we sourced them from China, but one of them is from Mologic, and it is the same antigen kit that Mologic has given to the Senegalese. Okay, that Senegal is using in its test development. Okay, I also want to say that we are basically ready with something that our regulatory authority is going to go through. Senegal hasn't reached that stage yet. Okay. When this thing is ready after optimization, we have a local company that will mass produce it. Okay, Senegal have to manufacture and produce its kits from the UK before they are trying to set up an industry locally that can do it. We in Kumasi here have INCAS who do that for the country. So let us all be grateful to God where we've reached now and the many ideas that have come in helping fight this epidemic. Importantly, as a university, I want to put out that there are many things we've been developing. Recently, our College of Engineering came out with an automated ventilator that could help our patients who have to be on ventilators. Our College of Art and Built Environment has also designed a nose mask and is mass producing it. Okay, and my own college, the College of Health Sciences, our Faculty of Pharmacy and Pharmaceutical Sciences, from the little beginning, has been producing sanitizers, alcohol hand gels, alcohol hand wraps. Okay, and that is one of the best in the country. Most of the patients who've had to be taken care of in our hospitals, the care has been done by our consultants. Okay, either from Fanoti Teaching Hospital or even at our own KNUST hospital there. The consultants have come from the School of Medicine and Dentistry here. Okay, all those who be involved in pharmacy practice, they all come from our Faculty of Pharmacy and Pharmaceutical Sciences here. And the testing, you know, KGC has been one of the groups from this university which has helped in this testing. Okay, in the recent months, there's been so much to test that now part of the testing is being done from the Department of Clinical Microbiology. Some aspect of it is done from the Department of Clinical Microbiology of this university. Okay, and then it is continued at KCCR. And this morning, we've talked about this rapid test kit development, which has come from our Departments of Medical Diagnostics and Clinical Microbiology of this university. There's so much we are doing as a university, and it is our hope that we'll be giving the support to even do more in these times. So thank you all for coming. If there are any questions, I'll take them. Thank you.
Thank you, Professor. Thank you so much. And so, quick, good thing is that this testing will give us results much quicker than what we have in the system. And it's supposed to augment what we already do. And the good thing also is that this is locally produced. And it is as a result of collaboration between the university and industry. We want to thank you so much. We'll take questions quickly and then try and find answers. So, if you have a question, let's
with regards to, I think you said we talked about this in that one. Yes, we heard that one is about $1. What's the cost of this situation?
We can't give you, both INCAS and us cannot give you the cost of a device at this time. Like I said, there are 3 different antigens we've used. Okay, 2 that have been procured from China, and 1 that has come to us from Mologic, the UK company that has been supporting the Senegalese. Now, Mologic has over a £1 million grant from the UK government to support African countries in this development. Okay, and when Senegal says it will do it at $1 or £1, it is due to the support that they will be getting from Mologic. If that is the antigen eventually we settle on after FDA's regulatory workup, then the price of a test will be low. Okay, but if that will be one that you need to procure from any other place, then obviously the price will be different. But I can't lay my hands on the fact that this is how much it is going to cost, or that much that one is going to cost. Thank you.
And the second one has to do with the specificity. How will your test study, how specific, how, when it comes to others, where would you go?
And these are all some of the issues that the
hello.
will come out and tell us.
Okay.
No medical device is perfect. And it depends on what you want to use it for. Okay. If you want to use it to rule in an infection, then there's certain sensitivity you want. If you want to rule out infection, then there's certain sensitivity that you want. In our discussions with the Ghana Health Service, they gave us some idea about what they want. Okay, and essentially we will need to do it on the FDA.
Okay.
What ours will be, and then, if necessary, it's all about optimization. You don't produce a test kit today and then it goes like that. You always need to optimize it. You need to find out how much of the antigen you need to put, okay, on the straight. You need to find out